So great to be here, everyone. And thank you for joining us and welcome to the Health Roundtable, addressing the Delta deja vu and its effects on children and families. I'm Hitha Palapu, and I will be moderating this conversation. And I want to thank Pump Spouting, House of Wise, Vivi, and Mother Honestly for putting together this summit and for bringing up this incredible panel together to discuss this very important conversation on the impact of COVID, as well as on women and families. It's not clear whether Delta causes more severe disease in children, but its high level of infectiousness is causing a surge of pediatric COVID-19 cases. And it's why we have rounded up the nation's top leaders in pediatrics, pharmaceuticals, data, health, economics, all mothers themselves, to discuss how families can approach care, school, and work in light of the ongoing pandemic. I'm joined by three powerhouse women today: Professor Emily Oster, bestselling author and economist; Dr. Helen Egger, the co-founder and chief medical and scientific officer at Little Otter; and Dr. Kelly Fraden, pediatrician and author of Parenting in a Pandemic. I'm going to bring on each panelist to introduce themselves. Welcome, everyone. And I would love for Professor Emily Oster to kick things off with introductions.
So hi, thank you so much. I'm so excited to be here. My name's Emily Oster. I'm a professor of economics at Brown. I write books about pregnancy and parenting. My latest one is called The Family Farm. And I write a newsletter called Parent Data, which is all about parenting and data, and these days mostly about COVID. And I'm so excited to get to talk to all these wonderful ladies who I see on Instagram and occasionally in real life. And so this is really a treat.
Amazing. Dr. Helen Egger, please.
Hi, I'm so thrilled to be here. I'm a child psychiatrist, and I co-founded Little Otter, which is a digital early childhood mental health company for kids 0 to 12 and their families. I founded it with my daughter. And I was in academia before joining and founding Little Otter, and I'm thrilled to be here and to be able to talk about the impact of this really difficult time on all of our mental health.
Dr. Kelly Fraden, please.
Hi. So I am the mother of 2 kids and a private practice pediatrician here in New York. And before the pandemic, I was working in school health for New York City Department of Health. And so I had a firsthand seat to like what happened here when we locked down and everything went crazy. And I went through a career transition at that point. And during my break while Zoom schooling my kids, I wrote the book, Parenting in a Pandemic, which is now like over a year old. But unfortunately, the pandemic is still going on, and I'm happy to be here to talk about why and how I hope it will end one day.
Yes. And everyone, please, as questions come up, add them in the chat. We'll definitely make time to answer them. But I do want to kick things off with the state of the pandemic, where we are, and also how that depends on where we are, how to figure out what our personal risk is and what's the landscape of COVID right now. And I want to turn it over to Emily first, as she is our resident data guru, to talk about, what's the state of Delta, COVID, everything in the United States and around the world.
Oh, okay. Only that.
Small thing.
Sorry, it's very short. So I think there's a sort of like good news, bad news aspect of this, which is that, relative to a month ago, actually cases have been coming down. And so we really saw, a huge spike towards the end of the summer. And at this point, cases are declining across all age groups, which is good. As people have sort of continually said, there's just a huge geographic variation in the impact of the pandemic right now, particularly if you look at hospitalizations, where if you are living in a state with a lower vaccination population, we're still seeing the high rates of hospitalizations. We're still seeing 2,000 deaths a day, which is really, really tragic. There's really not a lot of other words for that. And then we're seeing places where there's very high vaccination rates, where we still are seeing some cases. We're seeing some breakthrough cases, but those cases are very unlikely to be hospitalized. And so the sort of disease situation in those areas is much better. And And I think part of what many of us are asking is, okay, well, what's the next step going to be? A lot of kids are back in school. Broadly, I think that's been going very well, but people are still nervous and anxious, and the holidays are coming up. I think I sort of see that as the next, like, okay, last Thanksgiving did not go in the regular way. Is this year's Thanksgiving going to go like that? And I think we're going to have some. That's going to be the kind of next thing to grapple with. So that's my big picture at the moment.
Dr. Freyden, about COVID in kids, can you give us a little bit of a state of how the rise in pediatric cases, especially with Delta, what the landscape is there, and kind of the landscape of therapeutics and vaccines for kids?
Yes, definitely. So one thing that I'm so thankful for is that COVID-19, for the most part, has been less severe in children. So we know that as many as half of children who get COVID don't have any symptoms. And I'm so thankful for that, but it does make it hard for us to have solid data about the epidemiology of COVID. So I think what happens is we see these headlines about communities where they've had particularly severe Delta surges in Florida or Texas, and the hospitals are filling up with children. And the problem is that we don't have a sense truly of how many children in those states have had COVID, because the testing isn't as robust as we would like, and we're missing those asymptomatic kids. And so I think what a lot of the context missing from those headlines is that we're only picking up maybe like 1 in 20 cases of COVID in those states. So the children who are hospitalized and getting really sick, it's still rare. I think Emily had put out some numbers estimating like 1 in 200 children with COVID ending up in the hospital. And I think it's about around there, even with the Delta strain, which might be marginally more severe. So it's a real concern. We don't want our children to get COVID because of the rare severe outcomes, including the multi-system complication, the MIS-C, and the long COVID cases that do come up rarely. We want to protect children from getting it en masse, but we also, we have to balance that with the reason that we're here talking about this, that, our mental health matters, participation in school and family and community groups matters. So, the vaccines are hopefully around the corner, and it is my biggest wish that we can start getting all of the American children back towards like more of a normal as soon as possible.
But can I just say one thing about the vaccines, which is I think we sort of, one of the things we miss and is part of the narrative that sort of I was highlighting is that the places that we're seeing high pediatric cases, those are reflecting low vaccination rates in adults. Right. So if you look at like no kids under 12 are vaccinated in Massachusetts and no kids under 12 are vaccinated in Mississippi, we saw a lot more cases in Mississippi than in Massachusetts. And that is because of adult vaccines. So people say, like, how can I protect my kid? The best way to protect your kid from getting COVID is to be vaccinated yourself if you are eligible. I think that's like, in some sense, we sort of can't say that frequently enough.
Yeah, absolutely. And I think that we have good numbers on that. We've seen it in the UK, we've seen it in Israel, that like when we start getting the adults, like over 70% of people in a community vaccinated, it protects even the unvaccinated children. Because vaccinated people, while you can have a breakthrough infection, everybody's seen that in the headlines too, it is much less likely that if you're vaccinated, you'll pass it on to somebody else. It's less likely that you'll get sick, and it's less likely that you'll transmit it. So for the health of like your family and the health of your community, it makes a big difference to get the vaccine.
Yeah.
And I want to turn it over to Dr. Egger, because what we're also not talking enough about is the mental health toll that living in a pandemic has taken on all of us for the past 18 years, and not just our kids, and the lack of socialization.
It feels like 18
years, but it's only 18 months. But that's a good slip. That's a good slip.
Listen, Mercury is in retrograde, time has no meaning, and this has felt like 18 years. So I would love to turn it over to Dr. Egger to talk about the mental health toll this has taken on all of us, which are we even talking? We're not talking about that nearly enough, and that's not getting the same kind of press and awareness that I think it needs to be.
Yeah, absolutely. And I think we start with what we have been going through and how what the kind of stressors we've been going through and how traumatic that is for so many of us. And of course, just like variation based on vaccination and rates of disorder, different families have obviously faced different stresses, whether it's economic stresses, housing insecurity, or losing a loved one to COVID. So there is obviously variation there. But I think what we are seeing right now is the fact that this has been going on for 18 months. It feels like 18 years. And I think we all had this hope that we were really at a precipice of change. And I think what I can speak for myself and I think so many of us feel is, wait, when is this thing going to end? And that is one of the things with mental health. You know, you think about trauma, right? Post-traumatic stress disorder is after the trauma is done. We are not in that position right now. We are still in the position of managing these challenges while supporting our mental health. So at Little Otter, we did a back to school toolkit for families. It was free to get information from families about kids' mental health and parent mental health. And we've just analyzed the data about over 700 families who participated. And I've just found it really poignant because we looked and asked parents, how have you been affected? How has your family been affected? And it's across the board. So parent mental health, parent physical health, relationships with your child or friends, increased conflict with partners and increased conflict in the family. And so when we're thinking about mental health, and particularly child mental health, I think we have to really think about at the family level, that this isn't just about recognizing when your child is having a challenge, but understanding that your mental health and how you're doing is going to be as important on helping your kids' mental health as getting your child help. So we're seeing increase in anxiety, actually more anxiety than depression, which makes sense because I think part of this time is this heightened anxiety. And I think with kids, what we're seeing is around emotional challenges, but also social challenges. Kids have been isolated. They haven't been able to interact with peers. And so I'm thrilled children are back in school. I think it's so important. And we are going to see some of the lack of opportunity to interact with peers and have social emotional learning in school. So, you know, I'm sure we'll get to it, but I think it's important to realize there's sort of a baseline sort of stress and anxiety that most people are feeling. And then when do we recognize when it's a mental health challenge that really could benefit from an evaluation and treatment?
I mean,
Yeah.
and that actually flows perfectly into the next question, which are what steps can we as parents be taking to protect their children at home and at school? And I would actually expand this question of like, what are some things we can be doing besides getting vaccinated, which is the most important thing you could do to protect your family from a health standpoint and your community? But what can we do to protect ourselves and our families from a mental health capacity and in a physical health capacity in these, what I hope are the final months of active pandemic life before this does become an endemic? So,
Yeah. I think one thing that's really important is that we take care of children's basic needs. So a lot of times I find myself referencing like the Maslow's hierarchy of needs, which is like in the social sciences. But the basic, having a routine, having structure to your day, having sufficient sleep, eating regular meals. So many families had those sort of architect of their life disrupted with schools shut down or with job change and housing insecurity. And so I think children need the predictable structure of knowing what's going to come next and who they can count on. And that I think the next layer on top of that is the social support. So, you know, the CDC has this whole bottomless pit of research about toxic stress, and what we've all been through has been a toxic stress, and it really indicates that one of the most important things at preventing the health consequences of that kind of stress is having safe, stable, nurturing relationships. And that's, the idea is like find your three, and that by having like three people in your life who you can count on, the children tend to be much more resilient. So whether it's people in your family or your extended family, your neighbors, your coaches, your teachers, your doctors, anybody, prioritizing making sure your children have those connections, I think, is one of the most important things we can do as parents.
Yeah.
Emily, I think like something we also get your insight on this is every family is going to have a different risk calculus for what they feel is safe for them family, utilizing the data and where they live. What can you share about how to help refine your own risk calculation in this time where I say we're in a transition period with the pandemic, with pediatric vaccines hopefully coming soon, the approval of some antivirals happening soon, where we can have more tools to manage the pandemic?
Yeah. So, I mean, I think part of what's hard about this is the sort of decision fatigue aspect.
Mm-hmm.
So, in some ways, I think for a lot of us, kind of every decision for the past 18 months has been scrutinized, like with like a fine tooth comb. Like every trip to the playground is like a fraught, like a space trip. And I think that in the end sort of has left people like, I have to deal with everything, and yet I'm sort of too kind of tired to make these decisions. And so I think part of what I kind of have tried to indicate to parents and try to help people think about is, you can kind of make those decisions a little bit in tranches in advance and sort of think about making them in a moment when you decide, okay, like, are we going to be people who go to the playground? And not every trip needs to be, scrutinized in that way. I also think from the standpoint of kids, I mean, it would just sort of echo a little bit what Kelly was saying, which is like kids are low risk. They're not zero risk, but they are very low risk. And in terms of particularly sort of severe disease kind of outcomes, fully vaccinated, if you're a fully vaccinated parent in your, 30s or 40s, you are at higher risk for severe disease than your unvaccinated 6-year-old. And that's just like, and so I think a lot of us sort of came into like, okay, I'm vaccinated now, I feel safe. And that's right. I think, by and large, you should feel safe. But I think then we're saying, I feel that my kid is sort of infinitely unsafe. And that's also probably not the right way to process that. And so I think the pandemic is so salient. It's so salient at all moments that sometimes it is good to step back, particularly around kids, and say, there are other risks that I have absorbed by having this person out in the world. And this is one of those risks. And at some point I will need to sort of move it into the bin of the kind of risks that I think about all the time, or I don't actually think about all the time, but I take all the time without thinking about them. And I think that tension, for me, people ask, well, when is it going to be over? I think it will kind of be emotionally over for people when they start to move that, when you sort of start to move it from kind of like most salient risk, most important thing I'm thinking about all the time, into sort of like the flip. Like I think about it, I try not to get it. I try to protect myself from it, but it's not the sort of most salient thing. And I think that's going to be a hard emotional journey for many of us.
Yeah, and I'd like,
yeah, please.
Yeah, I just wanted to add to that because I think that it's understandable. And as you said, Emily, families are trying to calculate risk and figure it out, and it causes a lot of anxiety for us as parents, right? But I also think we need to protect our kids from feeling that level of anxiety or even analysis that we are having. I mean, it's, even if you think away from the pandemic, you're taking your kid for the first day of kindergarten. I have 4 kids. Like it, you can feel anxiety, but it's your job to express confidence that they can go and that they're going to be okay and they can do it. So I guess as part of this, I'd like to say that, we can't protect our children completely from this, but I think really, again, getting back to what Kelly said, our job is to create as much as possible a normal, routine and the sense of hopefulness and flexibility so that anxiety isn't pervading everything. I mean, we're seeing, besides increased anxiety symptoms, interestingly, an increase in OCD obsessive compulsive type symptoms, not of the full disorder, but it kind of makes sense, right? Children have been learning about germs and masks and hand washing, and then that can get kind of generalized so that they're seeing the world as a very, very risky place, even when it's not.
And I think that also goes down to like how parents are experiencing the routine back to school colds, because I know, even with the precautions in place when kids are back in school, people have been getting sick and getting kind of routine bugs. But now, because we're out of practice with them, it's been 18 months, like now anytime a sniffle happens, we're a little bit like panicked, like, is this COVID? Like, and you might not even be that worried about if your child is sick with COVID, but you are also worried about like your community. Could we have infected or exposed somebody? And I think that understanding that what you're feeling is like you're not alone in feeling it, that it is unsettling, and kind of just trying to keep it in perspective that just because it feels startling doesn't mean it's a dangerous situation, and like we will all get used to it together with a lot of like extra testing in the meantime, because the only way to know if it's COVID or not is to get the test. But I would just also chime in that I think this whole conversation, you alluded to it before, it so depends on where you are, because in some parts of the country, like where vaccination rates are very high and COVID rates have been getting down and more stable, I think a lot of people are starting to like mentally move past some of this. But then in other parts of the country, it's still very much going to be an issue for a longer period of time if they don't get the vaccines. So when you're making these decisions, to be familiar with what's happening locally, the vaccine rate in your community and the percent positivity rate, to kind of just track it so that you're aware of what's going on, because those two numbers really directly influence your risk of being exposed.
Speaking of vaccinations, it's a passionate topic with many strong feelings for and against. And as the FDA looks to approve vaccinations or authorize them for children under 12, how should parents start to consider the various, again, risk factors, especially where they are, as they weigh the best decision for their families? And I think all of us are kind of in agreement of what we would do. But how can we answer the question for parents who are hesitant about, has this been rigorously tested? What could be the long-term side effects? What are the long-term mental health implications of the stress of getting vaccinated versus not vaccinated? I'd love to turn it over to Helen first.
Well, I mean, I'm sure that Kelly and Emily will weigh in. I think the goal is to make vaccinations not stressful. I mean, I think if it's a stress on the child, that's coming from how the parent is feeling about it. I mean, the majority of people have had our children vaccinated to go to school. You need to take vaccines. And so, yes, shots can be scary. And kids can be scared about shots. However, I think it's very important, in my view, not to act like the COVID vaccine is some very different thing. I think it is similar, and that you just are matter of fact, and there'll be a pinch, and then and we'll be done. And it's again, I think it's critical that as many people get vaccinated as possible, and to feel good about doing that and feel pride in being part of helping us to get past this incredible challenge that we've all faced with the pandemic.
Kelly, as far as like the trials that have been done in kids and the risks of vaccines, of side effects, whatnot, can you elaborate on that so we can give all the parents here the knowledge they need to feel confident in getting their kids vaccinated?
Yes. So this is a big topic that everybody's concerned about. I would say that I think most of the medical community views these COVID vaccines as like our generation's like man on the moon, like the fact that we were able to get the technology together and the distribution together so quickly to vaccinate nearly 2 billion people. It's a marvel and an amazing accomplishment. And I think viewing it through that lens, it kind of like puts it in perspective of like, it's a gift. It's not, it should be a positive thing.
Yeah.
These vaccines have been as tested as any other vaccine that we've had. I think it's important that people understand the emergency use distinction. The only difference between that and a regular vaccine approval process is 2 months of follow-up data rather than 6. Otherwise, they go through every safety check, every committee, every phase. They're the same size clinical trials approximately as the other vaccines we use all the time. And with regards to a couple of the other common concerns, none of the nation's leaders in OBGYN and fertility science have any concerns about fertility effects of the vaccines. Allergic reactions to vaccines or rare immune consequences of vaccines like Guillain-Barré happen with all sorts of vaccines, and they tend to be the same or less than if you were to get sick with the actual virus. So it's, long reactions from a vaccine typically are over within a week or two. So like long-term complications from the vaccines aren't really theoretically, they don't make very much sense. And the last thing I would add is that that it is really a kind of freeing and emotional thing for people. I have to say, some of my doctor colleagues volunteered in the stadium where they were vaccinating people in case somebody did have a reaction. And the only things they ever got contacted about were anxiety and emotional reactions to getting vaccinated. So I think it's good to provide support around the process, but to hope that it will lead to more freedom for our children going forward.
And Emily, can you talk about the data parents should be looking at, not Facebook news alerts, as they make a calculated decision for their children on getting vaccinated?
Yeah. So, I think one thing is, so I guess my perspective on this maybe is a little bit different in the sense that I think it is very likely we'll see a fair amount of hesitancy in parents about vaccinating younger kids because we have seen that in the 12 to 15, right? So vaccination rates in the 12 to 15 population are the lowest of sort of any age group, and that is sort of generally vaccination rates increase as you age. But that there's been a sort of struggle, and I think when I talk to parents, even parents who themselves were kind of very enthusiastic about getting vaccinated as quickly as possible have sometimes expressed more hesitancy about their kids. And so as we get into this next phase, I think it is going to be extremely important not to talk about that hesitancy as a kind of well, you're just an anti-vaxxer, you're because unlike some other age groups, this is a lower risk group. And so I think it is the risks are small, vanishingly small, and I will vaccinate my kids, but the benefits are also smaller than they are for your 95-year-old grandmother. And that's just the reality. And I think it doesn't make a lot of sense to ignore that or to overstate the risk to kids to sort of encourage people to do this. So I really would like to sort of meet people where they are and help them understand what the data is saying, how carefully the FDA reviews this, and also how many of these vaccines have been given, and some of the auxiliary benefits, this is going to limit your need for quarantine. Right. This is going to protect your, immune compromised parent from a breakthrough infection. This is going to prevent your kid from getting COVID, which we sort of all know, but is also good to emphasize. And I think just kind of working through all those things and then being patient with people. There are people who are not going to want to be there on day one, who are not, if they do these vaccines by Halloween, some of us will be there in our Halloween costumes at the stadium, trying to get our kids vaccinated before trick-or-treating. But that's not going to be everybody's thing. And we're going to need to be willing to wait. I think that's fine. That's okay. To be able to say, okay, it's now been 3 weeks and they vaccinated, 6 million kids in America. Let me show you, we haven't really seen much, and those conversations will need to happen with your pediatrician. So,
Yes.
You need to have those conversations.
I can't tell you, so many parents, in the 12 to 15 age group, when the approval first came out, it's maybe they didn't get it. But then when they came for their back to school physicals 2 or 3 months later, we could be now we have, 25 million children who have had this vaccine and done fine. Does that make you feel more comfortable? And for a lot of parents, it's like, yeah, I was just waiting for that. I didn't want to be the first, but I'm here for it. It's like, okay, great. And that it's called the post-marketing surveillance. That's like why we do the VA-ERS through the vaccine registry. You know, we look and we do get more information. You know, you get some information from the trial with 2,700 participants or whatever it is, and then you look really closely, and then you find those 1 in a million kind of things. Like we did see the myocarditis in the 12 to 25-year-old age group, especially in boys. And we anticipate that that's going to be less common in the younger kids because the dose is smaller. It's like a third of the dose. But you know, we won't know the exact frequency it happens until more children get it, because you can't really look at that in a smaller trial. So for some parents, that number, like whether it's 10 in a million or 20 in a million, might affect their decision making. Whether or not, you know, you're one of those parents, I don't know. I think those kind of conversations are best individualized. Like, what are your values and what matters to you and what makes sense for your family?
And please talk to your pediatrician about this,
Right.
not strangers on the internet.
Yes.
Like, you have your physicians for a reason. You use
Right.
them. They should be your primary source in this. Before we get to the questions that have been submitted, the last one I want to ask is, you know, we hear parents quitting their jobs to support children, especially those who have been struggling or in need of behavioral health care. How can parents support their kids' behavioral health needs? And when should parents seek expert care?
Do you want me to start?
Helen's I would push for Helen.
Bring the child psychiatrist in, but pediatricians certainly know, since that is often the first place that you may go is to your pediatrician. I think that the question, I like to put it like, when do you worry? When is this sort of normal variation or the kind of temporary variation that you see with transitions, like the start of school, or it can be during the holidays or during different things. And really what we want to look for are areas. So if you talk about emotional challenges like anxiety or depression, you want to look for symptoms that are really lasting more than 2 weeks and are happening much of the time. So we have to remember with emotions, we all have emotions. We all get sad, we all get afraid, we get anxious. But when it gets into the area of being something that might be clinically significant is when it's more intense, when it lasts, when it's occurring in different areas of the child's life. So it's not just at home, but it's at school or in some kind of after school setting. And also that it's impacting the child's functioning in some way. So it could be impacting at school in terms of behavior, it could, or ability to make friends or other areas. But what's really important from my perspective and thinking about when things are possibly clinically significant is also to look at how it's impacting your family. So it's not only is it adversely affecting your child, but how are things going in your family? And you raise the question, if you can't go to work, you know, which you would want to go because of challenges your child is facing, that is an immediate red flag to get some help, because then it's really impacting your family's functioning. And, you know, if every day feels like a battle, and you sort of wake up in the morning and just think, how am I going to support my child, help my child, manage my child? Then that is really, in my view, a time to think about getting help. The last thing I'll say is, particularly my specialty areas is young children, so children 2 to 8 years old, is to remember that younger children show us their internal distress, their emotional suffering, anxiety and depression through their behavior. So that a child who is having, for example, frequent and even aggressive temper tantrums, hitting, biting, kicking, that child is as likely to have an emotional challenge as a behavioral challenge. And so I think it's important as a parent to look at behavior again, not as bad behavior or not following directions or, acting out, but really to look at behavior as our way in to what our child is experiencing. So for little kids, I call those kind of tantrums frequent and aggressive a mental health fever for a child. It doesn't tell you what's going on, but it's a sign you can look at to say, well, maybe first we should talk to our pediatrician and just look more closely at other things that are going on. And then possibly we should go to see a pediatric specialist mental health provider.
Thank you for
Yeah.
that. Go ahead.
I would echo a lot of what you said. That's really great information. I think frequently what comes up is that parents naturally try to accommodate their children's needs over time to help their behavior or to help their functioning. So you might find that you're not doing activities because it makes your children anxious to think about going somewhere new or seeing someone new, that you're not doing things that you would otherwise enjoy. And for me as a pediatrician, that's often a flag when those accommodations start to add up. It can be
Definitely.
like a little bit of a surprise because you get so used to the day-to-day way that you make your life work as a parent. But then when you take a step back, you're like, well, actually other people don't have to do X, Y, and Z to get through the day, and we do. And that's a sign that maybe it's time for some help. And again, it's I can't tell you how often sleep is a huge issue for this. We know that if children and adults aren't sleeping well, that they feel more anxious, and the effect size, my statistician friend can confirm, but the effect size is similar to drugs. It's in trials, when you improve people's sleep, you decrease their anxiety by 40%. And so it's a great place to start too if you're confused about, if you're worried about your child's anxiety level. But unfortunately, access to care is really challenging now. It's hard to find. A lot of psychiatrists haven't gone back to seeing people in person, which for young kids can be hard. And for older kids, there's a lot of need. And before the pandemic, only 1 out of 5 children really had their mental health needs served. And now it's even worse. There's just huge shortages. So we try to troubleshoot as best we can in primary care. And sometimes we even take on treatment for older kids or kids who have relatively straightforward needs, getting them started while they're waiting. So your pediatrician, your school counselor, there's a lot of different ways to get support for your child if they need it.
Yeah. And I think, well, this is, of course, why I left my job as chair of child psychiatry at NYU Langone, which was an amazing job, and left academia because of this question of access, because most kids don't get access to care. And even fewer get access to evidence-based care that's effective. And so, I think thinking about other ways to be able to access care, but it's a huge problem. And I think what I would say is, it's, from my perspective as a child psychiatrist, it's even more upsetting that people aren't getting care because we can help. So even in the example of accommodating and trying to keep your child from experiencing anxiety, we have wonderful ways to teach children. We don't want to teach our children to avoid feeling big, hard feelings. We want to give them the tools to be able to manage those feelings. And so there is such effective care that can make such a difference. And good pediatric care always involves the parents, because as a therapist or psychiatrist, you're with that family maybe 45 minutes a week, and the rest of the time, the family is together. So it really should focus on skill teaching for kids in combination with skill teaching and support for the parents.
We only have a few minutes left. So there's one question I really want to have answered, especially as the holidays are approaching. And it's, how do we handle the anxiety again around the holidays with more movement, but also more pressure because it's the holidays.
Yeah.
I would say, I thought a lot about this, a lot about it last year. I think that, one piece of this is to accept that, like, actually, if you are all vaccinated and you have low risk people, it is a lot safer than it was last year. And, it's not an unreasonable thing to do. And there's some real value to getting together. And then I think the second thing I would tell people is focus on the stuff. If you're anxious about this, focus on the stuff you can control, not on just sitting around worrying about it. So if you're worried and you think like, well, what would make you feel better? Well, maybe it's rapid testing everybody. Great. So get some rapid tests at walmart.com, $14 for a box of 2. I wish that they were cheaper. That's what it costs at the moment. And, have those and test everybody before they come. Or, would it make you feel better if, somebody didn't go to an indoor concert the week before, like, whatever it is, like, sort of think about the stuff that you have control over and not the just like, I'm going to sit around and be anxious about this. And I think it's kind of like there's too much anxiety and not enough like, well, just what could I do? And if there's something I can do, it just doesn't really make sense to worry. I mean, it's hard to not worry, but like sometimes you got to just like try to actively turn that off.
I think I would add to that, and I think it was true last year, and obviously it's somewhat different, but to realize that the holidays are really stressful. And I mean, in terms of there's a lot that's joyful, but it's also a time when you get together with family, there can be conflict, there can be other issues that are coming up. I think a lot of time we as moms put a lot of pressure on ourselves to make it perfect and great and wonderful. And so I would really encourage people to realize that when you've been going through this kind of chronic stress that we've all been experiencing, that's the time to really think, what's most important? How can I focus on really making sure that it's joyful and somewhat relaxed and really sort of pare down in some ways to what's most important. And that I think that there is a lot of feelings of excitement about the holidays, which is great, but there's also a lot of dread. So it's okay to acknowledge that and think about how you're going to manage that as well.
This is your permission to cater Thanksgiving dinner if you can.
Exactly.
Not worry about
perfect example.
Yes.
Exactly. The table doesn't have
I hope
to
my
be
mother is watching
perfect.
this because of some previous discussions about not catering Thanksgiving dinner.
Listen, the restaurants will appreciate the business, and you have one major thing off your plate. So I highly encourage it. So it's what we're
Great recommendation.
We have some rapid fire questions that are more medical focused, and I think I'd love to get as many of them as possible. Masking. Should we be masking out and about if we are vaccinated? And what about getting a booster?
Well, it's a complicated question. Masks, especially like surgical masks and higher, definitely work, especially if you're indoors or in a crowded environment. I would recommend them. In regards to boosters, we have good evidence that the immunity provided, especially by the mRNA vaccines, the Pfizer and the Moderna, is still very good 6 to 8 months after receiving your second shot. So right now, the only people who are recommended to get a booster, there's two categories. There's the should and the may. So the people who should get a booster are people who live in like a long-term care facility, who are over 65, who have immunocompromised, or people over the age of 50 who have chronic conditions that put them at higher risk. The people who may benefit from a booster are the younger people, 18 to 49, who have risk factors, including those who are pregnant or expecting. And then the 18 to 65-year-old group who's at higher risk of exposure, which includes like teachers and doctors and things like that. Yeah. So the idea is that those people benefit by going from like 78% effective to 92% effective. I think boosters for J&J are coming soon, and in some places like in California, maybe depending on your doctor, they may be offering them now, because I think the benefit of a booster for the J&J is probably outweighs the risk.
One last quick question. Someone asked, a friend won't get vaccinated because she got COVID earlier this year and she thinks she has immunity, and she does. She has infection caused immunity. Could she still transmit to others more easily since she isn't and won't get vaccinated?
This is a great question. I think it's in the conventional media. We haven't talked a lot about natural immunity. It does count, but I think it's a lot less predictable than vaccine-associated immunity. I definitely have seen many people who got sick. Maybe they were even sick for like a week, pretty sick, had antibodies, the antibodies went away, and then they got it again. We know that reinfections happen. I think antibody levels are a pretty good proxy for whether or not you still have protection. But then the question is, like, are you going to do it every 3 months for the rest of your life, or are you just going to get a vaccine so then you can estimate how protected you are more long term based on better data? So, my husband had COVID twice, actually, so I know that very well. That your immunity wears off. So I strongly recommend it, even if you had it before.
Yeah.
And with that, thank you so much to this incredible panel for this incredible conversation. We hope that you feel a little bit more informed, a little bit more empowered to make some really hard decisions in the best benefit of you and your family.